Good morning, my name is Attilio Olivieri. I'm a full professor of hematology at University of Ancona, Italy, and director of hematology unit, a stem cell transplantation unit at the Ospedale Riuniti of Ancona, Italy. I'm involved in GvHD. I was a member of NIH Consensus Conference, and I developed very recently software for evaluating the response in chronic GvHD patients. This software uses an algorithm and can capture all the modifications of patient and physician-reported symptoms. What about GvHD? GvHD is a rare disease, but is still the leading cause of non-relapse mortality in transplanted patients. Particularly, chronic GvHD is the main cause of poor quality of life in transplanted long-term survival of transplanted patients, and the incidence of GvHD, chronic GvHD, is about 40%, with more than 3,000 new cases per year in Europe. GvHD is still an unmet clinical need because the response rate in both in acute and in chronic GvHD did not change in the last 20 years, so we urgently need new drugs and new therapeutical interventions. What about novelty approaches in these ASH conferences? So, why in acute GvHD field the pathophysiology of GvHD has been well elucidated by the Ferrara group. In chronic GvHD setting, many aspects of biology are still unclear, but recently, particularly in the setting of the cooperation of T and B cells, some new approaches have been reported, particularly the importance of cooperation between T follicular helper cells and germinal center B cells, leading to the production of auto and alloreactive B cells. What about new possibilities of intervention? Simplifying practically speaking, we can intervene. We can act through three different important steps. The first is the cooperation between the B and T cells. The second is B cells pathway, and the third is the T cell pathway. The Dana-Farber Cancer Institute group reported, the first name was Kamahara, that the administration of low-dose interleukin-2 is able not only to expand Treg cells, but also to significantly inhibit T follicular helper cells, reducing the number of auto and alloreactive B cells. Other new approaches are represented by the association of interleukin-2 low dose with extracorporeal photopheresis and the administration of Treg. These data have been reported by the Dana-Farber Cancer Institute with interesting biological data, but the clinical results are still pending. Very important results have been reported by the German group with the use of mesenchymal stem cells in a new fashion, because they proposed the use of batches of mesenchymal stem cells from several donors in order to standardize the anti-proliferative activity and the ability to induce tolerance of these cells. And in 69 patients, this approach achieved about 80% of complete response, which is very important in this setting of steroid refractory acute GvHD. Another approach is represented by the prevention of GvHD. At least three main approaches can be considered. The first was the administration of a CTLA-4 antagonist, abatacept, which is a drug currently used in patients undergoing renal transplantation or with arthritic, rheumatoid arthritis. And the administration of this drug in patients receiving mismatch-related transplant achieved a very important reduction of the severe acute GvHD incidence. Indeed, the incidence of acute GvHD was only 3% compared to the historical control of 30%, and this led also to a significant reduction of transplant-related mortality and improvement of event-free survival. The second approach in preventing acute GvHD is represented by the expanding role of alpha-beta depleting in haploidentical setting. Particularly two centers from Rome and from Tübingen presented very important data about this approach. The center from Roma transplanted 112 patients with this approach by using the administration, the reinfusion of alpha-beta gene transduced cells and no further immunosuppressive therapy. The Tübingen study reported results about 60 patients with equally good results. Finally, in the setting of match-related donors and match-unrelated donor, the use of cyclophosphamide post-transplant is expanding, and an ABMT survey by Attilio Olivieri showed that the incidence of severe acute and chronic extensive GvHD was significantly reduced.